About iron deficiency anemia, uh, I'm talking from using the Merck Manual Professional Edition about iron deficiency anemia. Okay, so pathophysiology starts with considering where the iron most is. 3.5 gram and 2.5 gram is in men and women respectively gram of iron in the body, and it is dis- distributed in the different things where hemoglobin and ferritin have maybe the most iron in the body. So now in the iron absorption, he mainly talks about the difference between ferrostate and ferric state, where ferrostate comes from meat iron, hemoglobin, hem iron, which comes from meat, and ferric state comes from vegetarian diet. The non is called the non-hem iron. Non-hem iron is ferric state, which is less absorbable compared to the ferrous state, which comes from the meat is absorbed much better. Ascorbic acid, it points that this vitamin C can help absorb iron compared to antibiotics or different foods that can, especially calcium, they can inhibit the absorption, especially inhibit the absorption of the ferric state, namely the iron, which is non-heme iron, comes from vegetarian diet. Now it tells you how much the diet contains of iron, 6 milligram, etc., etc. Uh, and another thing is that if you absorb too much of iron, the body will reject it by increasing the levels of hepcidin, which is a protein that is secreted from the liver, which inhibit the absorption of iron from the intestine, in order that we won't absorb too much of iron to the body. Okay, so the storage of iron in the body is mainly in two places, in hemosiderin and in ferritin. The most important one is the ferritin, and this is the one we're checking in blood test. And this is the most important evaluation for iron stores. There is one problem with ferritin, which is acute phase reactant. Therefore, in inflammation state, it may be high even though the patient lacks iron. But in normal state, ferritin is maybe the most specific and sensitivity test for evaluation of the iron state in the body. Namely, low ferritin means iron deficiency. In if there anemia, iron deficiency anemia. Okay, etiology. Etiology of iron deficiency anemia, blood loss is maybe the most common one, and we need to think maybe the most common blood loss is from menstruation in women. They are losing blood cumulatively every month, but other things are in old patients from GI loss from colorectal cancer, from the stomach, like in peptic ulcer and Helicobacter pylori, which can cause gastritis, hypochlorhydria, which decrease the absorption of iron in the GI tract. Other things like angiodysplasia in the colon, which is dilated blood vessels in the colon that can bleed, and we can lose blood from there. Okay, increased iron requirements like in pregnancy, like in lactating women, okay, and decreased iron absorption, which is rare, not rare, but less common than blood loss, is from what I said about Helicobacter pylori, celiac disease, inflammatory bowel disease, maybe atrophic gastritis, and you can see other things, malabsorption, like after bariatric surgery. Okay, now symptoms and signs of iron deficiency. They are the common sign, like or the common symptoms like fatigue, like weakness, like dizziness, like a reduce of concentration, memory impairment, restless leg syndrome, changes in the nails, which is not quite common, but cholionychia, pica syndrome, which means that patients sometimes want to eat very strange things like I don't know, ice cubes and things like this. This is pica syndrome. So the diagnosis is based on the complete blood count, where you should see decreased serum iron, decreased red blood cells, decreased hematocrit, decreased hemoglobin. So decreased hemoglobin, decreased hematocrit, and decreased red blood cells is the definition of anemia. But what is more specific to iron deficiency anemia is decreased ferritin, maybe the most important test. It says here lower than 30, decreased iron serum, which is not very stable, decreased MCV, which is not very specific to iron deficiency, but iron deficiency anemia causes microcytic anemia, which is anemia that the volume of blood cells, red blood cells, is decreased. So we have lower mean capsular volume. We have lower MCV in iron deficiency anemia, and other anemias can also cause MCV to be lower, like thalassemia, and maybe other things that I don't remember quite now. So, CBC, you can see lower MCV, lower hemoglobin, lower ferritin, lower serum iron, but higher RDW, which is a representative of anisocytosis, namely different size of different blood cells, anisocytosis. Also, there is reduced or lower than expected reticulocyte in the peripheral blood. Reticulocytes are a young shape of red blood cells which should be elevated when there is anemia, because when there is anemia, the bone marrow should increase the rate of releasing young shapes of red blood cells to the peripheral blood. But in iron deficiency, there is problem in creating the red blood cell. Therefore, when there is anemia, we would expect high levels of reticulocyte in the peripheral blood, but in iron deficiency anemia, there is low levels of reticulocyte, which is logical because there is problem in creating of red blood cells, including young shapes of red blood cells. So RDW is high, MCV is low. Transferrin, which is the protein that is responsible for taking the iron from the GI to the bone marrow to utilize it to create red blood cells and hemoglobin, or to create hemoglobin, is higher in iron deficiency anemia because the body tries to absorb as much iron as possible. So transferrin would be high, NCV low, ferritin low, serum iron low, hemoglobin low, RDW high. This is the image, the blood image we would expect in iron deficiency anemia, what is called type of microcytic anemia. And it starts with telling us the stages of iron deficiency. Okay, but what I told you is quite the idea. And there are different things that can cause microcytic anemia, and it talks about the thalassemia, anemia of chronic disease, which sometimes can present with microcytic anemia, or more precisely, deteriorate to microcytic anemia because mostly it's in the later stages. Okay, so treatment. Treatment can be oral or parenteral, and especially or most importantly, treatment of the cause if it is possible. If the patient has colorectal cancer, it's very important not to just give him iron, but to treat the colorectal cancer as soon as possible. If the patient has IBD, namely inflammatory bowel disease like Crohn or colitis, it's important to treat it. If he has angiodysplasia, maybe. if he has Helicobacter pylori with peptic ulcer, it's better to treat it and not just to give him iron. So the underlying cause should be thought of, and when we know what is the underlying cause, so we can decide if to treat or not to treat the underlying cause. If the patient has menstruation, but the woman doesn't want to take pills all the time and skip her menstruation, so she can keep her menstruation, but we can give her iron in when we know what is the cause and if we need or doesn't or we don't need to treat it. So iron supplementation can be given in dosage of 65 milligram a day, around this. Uh, Elemental iron, which is correlated with this amount of ferrous sulfate, and each type of iron if it is its own dosage, but 65 milligram of mental iron is the typical initial dosage. You need to note that too much iron at a time can cause side effects, which are the side effects of iron, which usually are constipation and GI symptoms. But giving too much iron won't help. I mean, if I give someone 65 milligrams of iron, but I will give him, I don't know, 300 milligrams of iron, I'm not sure, it's not very sure that he will benefit from it. Because remember hepcidin, remember transferrin, when the body absorbs too much iron, it elevate the hepcidin level, which is the protein that is responsible to inhibit the absorption of iron from the GI tract. So, giving too much iron at the time only increase the side effects but won't benefit the patient. So, giving around 65 milligram a day is the typical dosage. Uh, as you can tell you here, larger doses are largely unabsorbed due to increased hepcidin production but increased adverse effect, especially constipation or other GI abscess. So, another one thing is what to eat or not to eat with the iron. Calcium and other meals or other food can inhibit, especially calcium and things like this, can inhibit the absorption of iron. And there are things that can help absorb it, like ascorbic acid, namely vitamin C. So, orange juice and things like this may help and enhance the absorption of iron. Now, parenteral iron, namely injection of Ferinject or Venofer, can help when the iron supplementation orally is not enough, or the patient has too many side effects and he doesn't want to take it, or he needs more. Uh, but there are problems with the parenteral iron, mainly the side effects, which are mainly allergic side effects, which can cause fever, which can cause side effects that are not quite convenient. Other side effects like fever, arthralgias, myalgias can also develop, and anaphylactic reactions. So you should be aware of it and be ready for it. Even though today the incidence of this is lower because the iron is, how we say it, high molecular is lower molecular weight of iron, which is less anaphylactoid. Okay, the usual dose of parental iron is around 500 or 1000 milligram. Usually sufficient. It's based on the weight of the patient, but this is usually. The oral supplementation should be continued for more than 6 months after we corrected the dosage. Usually, in the start of the treatment of oral iron, in the first weeks, the hemoglobin levels won't change too much, but after this, you can see the elevation of around zero point 0.7 to 1 gram per week, or elevation of iron. And remember from this to think about the etiology, to think about the underlying cause that the patient has iron deficiency anemia, not just to treat it with iron, but to make sure that we quite understand the reason for iron deficiency anemia in patient, so we won't miss very important diagnosis. So thank you very much. This is about iron deficiency anemia from Make Manual Professional Edition. If there are any correction, please correct me. And that's it.